If you're looking for an overview and introduction to acceptance and commitment therapy or ACT, you have come to the right place. I'll share a little bit about the history of how ACT developed, basics about the goals and key techniques within ACT, and then exploring the 6 principles for psychological flexibility that are really the core of ACT. This video is going to be more of a basic overview of all of these concepts, whereas I'll have another video that gives more detail about specific tools and interventions within ACT, going in more depth. If you know of anybody who's associated with ACT, it's probably Stephen Hayes. Just like with many different therapeutic modalities, there's often several different people that have contributed to the development of it, but the number one with ACT is Stephen Hayes. And it really started back in the 70s, but in baby form in the 80s, it was called comprehensive distancing and has continued to evolve since then. Now, in a lot of psychological settings, they talk about waves of therapy, and this is very, very much an oversimplified version of that. There are many more therapeutic modalities that are not listed here, but we often think about the first wave being Freudian psychoanalysis and looking at, things like interpretation of dreams and early childhood experiences, followed by more of an emphasis on behavior modification. And then we had, cognitive behavioral therapies. And some would say that a fourth wave after CBT is related therapies like dialectical behavior therapy and ACT. Now, I'm giving you a simplified version because although Stephen Hayes is brilliant in many ways, as you can see from this clip here that I took from an Association for Psychological Therapies training, it can be a little dense and wordy to go straight from the exact source, thinking about it as a functional contextual intervention. And so all of these different things that you read here sounds great, but what does this actually mean in practical terms? So let's break it down in a little bit more of a clear and user-friendly way. We got to start with, what does it even stand for? Now, you might think the answer is obvious because I've actually said it a couple times already, but it's actually a little bit more complicated than you may realize. And I bet you didn't expect me to have popcorn as my next slide. Much like the theater or this popcorn brand, there are 2 acts. And I like to think of it as Act 1 and Act 2. Now, this is just my way of remembering. This is nowhere in the literature about ACT, but just a way that I remember it is the first acronym for ACT is Acceptance and Commitment Therapy. That's what I've said before. I'm talking about acceptance. I particularly like Dr. David Gillender's explanation. He did a lecture for University of Edinburgh in an online lecture, and he says it doesn't mean a passive resignation to misery and distress. It's not just about tolerating, but with its Latin origins, it's more about taking in what is offered, or that maybe a better way to think of it is willingness. And then committing speaks to committing to take action and in line with your values, and this is all a therapy. So Hayes in 2009 said the aim of ACT in lay terms is to create a rich, full, and meaningful life while accepting the pain that inevitably goes with it. That's the ACT that most people know about. The other acronym is to accept, commit, and take action, where the T is about taking action. So this breaks it down a little bit differently. You first accept that some thoughts, feelings, and circumstances are beyond your control. Commit, and so that starts with connecting, the other C, connecting to your values, and then committing to behaviors that align with your values, and then T, actually take action and actually do it. Okay, so those are kind of the 2 acts that I want you to think about. One is being the abbreviation for the name of the therapy, and one is being more based on what it's all about, really. I also want to point out that I've been pronouncing it ACT and not ACT. And my little way of my memory trick here is that ACT stands for a clueless therapist, okay? Because they do not know how to pronounce it. So you need to act like you know what you're talking about and pronounce it as ACT because it is behavioral motivated, and in the end we want to act on our values as well. Another little side note here, pet peeve of mine, is when people say act therapy. Technically that's redundant because the T stands for therapy, so it's kind of like saying acceptance and commitment therapy. And so that's just a little tip about how to talk about ACT. Aha! I bet you didn't expect a third ACT, but wait, there's more. It can also be used in a corporate context as acceptance and commitment training. But I'm talking about it more specifically in the mental health realm here. What do you think? Is the goal of ACT symptom reduction? So maybe reducing anxiety or depression, or a mindful, value congruent living? Well, actually, some people are surprised to know that symptom reduction is not actually the main aim of ACT. Whereas something like a cognitive behavioral therapy approach in classic form is going to look at changing your thoughts to make you feel better, the goal of ACT is mindful, value congruent living with a potential side effect or bonus of feeling better as a result. So that symptom reduction is a byproduct, but not the main focus. I'm going to give another quote from Stephen Hayes here that says, thus, in ACT, when we teach a client mindfulness skills, for example, the aim is not to reduce symptoms, but to fundamentally change their relationship with their symptoms, so they no longer hold you back from valued living. The fact that a client's symptoms are reduced is considered a bonus rather than the main point of therapy. Now, I will add the caveat here that it's important as a therapist to be careful about how you explain this to clients, right? Because most people come to therapy because they want to reduce their symptoms, not because they want mindful, value congruent living. They come because they want to feel better. And so you don't want to discourage someone of saying, you're actually not going to feel better, or maybe you'll feel better, but you also want to be honest about the aims. And so thinking through how to frame this in a way that is honest, but not off-putting, and still providing some hope. Now, this is completely just my idea here, my graphic. This is, again, not an official component of ACT, but the way that I often conceptualize therapy with my clients is that there's three main ways of approaching an issue. The one that often clients are most familiar with is that early wave of psychodynamic approaches that is more about insight or understanding. So perhaps understanding how a childhood trauma impacted the way that you are in relationships, or how attachment has impacted you today. That insight and that understanding. The next way to approach something is to change it. So, for example, in a behavioral context, maybe that behavioral activation in cognitive behavioral therapy, where you're doing these pleasureful experiences that make you happy, or cognitive distortions and cognitive reframing and restructuring, where you are disputing irrational thoughts, for example. That's changing something. Or it could also be changing your circumstances within the environment, changing a job or something like that. And then ACT is, I don't actually love the label cope here, but it was the best thing I could come up with, of kind of accepting things the way that they are and still being happy anyway as a result. So that's the way I personally see kind of different contexts and categories of therapies. Of course, again, there's many others here, but often if I have a client who has this understanding of therapy that they need to understand why they are a certain way, sure, we can gain that insight. Is that going to make you feel better? Possibly. Maybe you actually just need to change the way that you're thinking or behaving, and that'll make you feel better. Or maybe there's some things that doesn't matter how much you understand it, you can't change it, and you need to be able to have some level of acceptance and coping strategies to accept things that you cannot change, kind of like the Serenity Prayer, right? So ACT in a nutshell is all about psychological flexibility. I'm a yogi myself, and this appeals to me, right? That it can be good for our body to develop that flexibility, and likewise, it's good for our mind to develop psychological flexibility so that we can bend and not break when challenging things come our way. ACT has 6 components of psychological flexibility. They are necessary for psychological flexibility, and I'm going to proceed right to the next slide that actually shows these 6 in relationship to psychological flexibility. This is the famous ACT hexaflex. It is called that because it is a hexagon, 6-sided geometrical shape, and the flex because it's all about psychological flexibility. So that's why it's got the cute name, the hexaflex. This is developed by Stephen Hayes and Russ Harris, who's another common figure in ACT. And it's interesting, the more you read and hear presentations about ACT, you're going to see that different authors or people argue for a different order of these 6 in terms of which one comes first. Do you start right up at 12 o'clock? Do you start with values or somewhere else? And so sometimes acceptance and diffusion come first. Sometimes mindfulness and values come first. I think as a social worker, I say we start where the client is, right? And so depending on what is the most relevant or helpful to them in their situation, that's kind of what we focus on first. But I'm going to take you through what each of these means specifically, starting with diffusion. You'll see that diffusion is often written with D-fusion, which I actually like better. And that's literally the process of separating your true self from your thoughts or your memories. That your thoughts and memories, they're not me, they're just temporary states. That your thoughts are not fused with your idea of yourself. So having this diffusion of me versus what I'm thinking about currently. A metaphor that I really like to make this clearer is that me, my identity, is like the blue sky, whereas my thoughts are like clouds that shift, that come and go, and that we can be secure in the knowledge that that pure blue sky is always there, even if our clouds, sometimes light and wispy and sometimes big and dark and thunderous and scary. But that's emotional weather that comes and goes, whereas who you are is that sky, regardless of what's happening with your thoughts and emotional clouds. We often say in ACT, your mind is not your friend, but it's not your enemy either. Whereas CBT tries to change or control our thinking, ACT acknowledges that we have some control over our thoughts, but not ultimate control over our thinking, and that it can be challenging to change those thoughts. And so then we just need to separate ourselves from those thoughts instead of changing them. And the opposite of diffusion, as you might guess, is fusion, like two, hot metals fused together, for example. So we're wanting that separation where we watch our thinking. That is diffusion. Next, we have acceptance, which I already talked about a little bit, since that's the name of the game with ACT. Acceptance is sometimes also called expansion because we make room for things. Instead of railing against our often negative feelings or thoughts, we don't have to like them, but we can accept them. We can tolerate them. So less Disney's Frozen of let it go and more Beatles, let it be. That's the way I like to think about acceptance. That's my memory trick here. So the opposite of acceptance would be experiential avoidance, because instead of accepting how we feel, we are trying to numb it, run away from it, hide it, something like that. Accepting even our negative emotions can ultimately help us to act in line with our values. And the unfortunate truth is that the bliss that we all hope for is not a normal default state for human beings. Now, with acceptance, we talk about this with clients, we want to avoid straying into insensitivity. So you can accept or encourage someone to accept while still demonstrating empathy and understanding and validation. So we should always think critically about these concepts and how they apply to certain clients, For example, if someone has been assaulted or faced racial injustice or discrimination, we don't want to come across as minimizing. Oh, no big deal, just accept it. That's the way life is. But rather, we are accepting that unpleasant emotions are a normal part of life and a normal response to terrible and tragic things that can happen to us, and that you can accept that temporary state and then take action, in line with your values to hopefully feel better. The next part of the hexaflex is contact with the present moment, or be here now. This is what I like to think of, the one related to mindfulness, which one of my favorite authors, Jon Kabat-Zinn, defines as non-judgmental awareness of the present moment. It's about noticing. The opposite of contact with the present moment would be having the past or the future dominate, and you're always thinking about one or the other instead of just being here now. I could do an entire lecture or entire course on mindfulness, so I can't begin to describe all of the different exercises and elements of mindfulness. But the key here is that while meditation can be a form of mindfulness, you can mindfully do just about anything, like eating, driving, doing the dishes. So it's being present. ACT likes to talk about our brain as a problem-solving machine, and that our mind does a great job of solving problems, but our brain is a little bit of an overachiever and tries to keep solving and resolving things from the past, or anticipating future problems that don't yet exist. And so you can say, hey, thanks, brain, for your service. I appreciate you helping me out about, solving these problems. But I don't need you at just this moment. I'm going to focus on my shower or whatever that might be. I'm going to jump down here to self as context, and this is highly related to diffusion. It's often also called the observing self, where you have your true underlying core self regardless of your circumstances. And, so it can be that your temporary states are good or bad. Sometimes I'm happy, sometimes I'm patient, not always, right? So thinking really about who am I, and separating yourself from the thinking self, the clouds, to your observing self, where you are your true identity, the sky, observing what is happening in your brain. So just like right now, as you're listening to this video, you can hear my voice, but my voice is not you. It's just something that you're experiencing right now. There's some transient content going on between your ears, nothing more than that. Same thing with your own thoughts. So whereas diffusion is kind of the process of separating these two, the self as context is more related to your observation and identity as the observing self. Now, again, let's think critically about all these and consider that these might not be appropriate for everyone, right? So for example, it could be contraindicated if someone has, for example, a dissociative identity disorder, DID. So if you're already struggling with identity and splitting of the self, it might not be the greatest idea to go down that path even further and create more of that separation between different forms of self. Just kind of considering how this might apply to certain diagnoses or populations. Now I'm going to jump to values. So I would say that acceptance and values are the two elements of the hexaflex that are usually the most emphasized and the most well known in people who are not as familiar with ACT. So values is thinking about, what do you stand for? What's your purpose? What leads you to have a meaningful, not necessarily pleasureful, but a meaningful life? Values are present focused, whereas goals are more future focused. Values are not preferences. So, I like pasta, but that's not one of my core values in life. And values are freely chosen. You might have the same values as your parents or your faith-based organization, but values are your own. They are not imposed upon you by somebody else because of tradition or culture. They're your own chosen values. And I say here, let's not get caught up in definitions, though. If it's good enough to help you guide a meaningful life, that's good enough for me as a therapist. I don't want to get legalistic about this. This is meant to be a helpful exercise and not a grammar exam. So basically the key is whether it's something that you can actively pursue, like health. You know, some people might say that health is more of a goal. You know, you want to be healthy, but to me, I think if you value health, that's great. You can take actions to support your health. So the values is knowing what matters and being intentional and clear about what matters to you. Then we have committed action, which is where you just do what it takes to live out those values. And again, this is why ACT is ultimately a behavioral intervention, because it's all about living in line with those values, that we should be moving towards action because those actions should be valued and fulfilling and not just as an escape. So to take an action, you should be running towards your values and not running away from pain. The way that I like to conceptualize this is I like to tell my clients or my clinical supervisees to imagine a beautiful cathedral. I've been fortunate enough to get to see Notre Dame and some beautiful cathedrals. And if you've ever stood in these huge, massive cathedrals, you're just in awe. It's a really cool experience. You're mindful, you're kind of present. It's great, right? You might feel good in that moment, maybe even feel a spiritual connection. But if you go into a cathedral because you value adventure and exploration, or because you value your spirituality, or you value learning and growing, maybe learning about architecture or history, that could be a great example. But if you are in a cathedral because you need sanctuary, because you are running away from people with torches and pitchforks outside who are trying to burn you at the stake, your experience in the cathedral is probably going to be one marked by fear and anxiety, and it's not going to be a great experience. Either way, you're still in this gorgeous cathedral, but what's different is your intention of why you are there. So similarly, someone with an ACT mindset could think critically about behavioral activation in cognitive behavioral therapy and say, if you are running away from how you're feeling by maybe misusing substances or something like that, that's not going to be a helpful thing, even if it makes you feel better in the moment. Whereas if you are chasing and going towards your values, that's going to be a better way of acting. The opposite of committed action here would be avoidance or inaction. Here's my summary with little images to help remember some of these. Contact with the present moment, committed action, just do it, right? Diffusion, dividing yourself and values. What do you value in life? What's most precious and important? Self as context. Who am I, as Zoolander would say? And acceptance, having open hands about what life gives you. Now, if you're ready for another geometry lesson, we've got now the triflex, which is essentially a more simplified version of the hexaflex. And it's summing up that there's really 3 major elements here, which are to be present, do what matters, and open up. And that defines psychological flexibility. So nothing really new here. It's still these same 6 that are on the triangle, but it's just a different way of conceptualizing this, where you have the different sides here and kind of which ones are most related. So I mentioned when we were talking about the hexaflex, that diffusion and contact with the present moment, there's so many of these that are similar to each other. My personal recommendation for some further reading, if you would like to learn more about this, is Russ Harris's book, The Happiness Trap, as well as there's many different manual and books that have worksheets and things like that you can use as a therapist. But one that I found particularly helpful is called Learning ACT, and that's by Luoma, Hayes, and Walser. So those are some ways that you can learn more about it, but I'm going to have another video that you can check out that goes into each of these in much more detail and goes through each of these 6 elements of psychological flexibility and gives examples of how you would guide a client through that, what kind of exercises or activities or homework you would assign to do that. So check out that next video if you want to go deeper here. In summary, ACT is pronounced ACT, not ACT, because it's ultimately behavior oriented. The goal is mindful, values congruent living, but symptom reduction is a common bonus. And to have psychological flexibility, you must open up, be present, and do what matters.